Today, we are going to discuss our TIP projects that were recommended for 2024 and give you an update on safe streets and roads for all. We're going to talk about one of our projects that's currently in the public involvement phase, Yeager-Milburn, the MoDOT arterial study, and the county's budget. Glenn Henninger, our Assistant Division Manager for Planning and Programming, is going to kick us off with the discussion around TIP. Glenn?
Thank you, Misty. Welcome all. Usually in a meeting like this, somebody will start with introductions. As you can see from the top of the agenda, we have way too many people to go around the room. So just a basic welcome. As Misty mentioned, we usually start this meeting off by going over the TIP projects that we received. Notifications come out this time of year as far as staff recommendations from East-West Gateway. So it's a good time to update the group on immediate future funded projects. We did receive 4 out of our 9 applications, so a little less than we're used to, but there was not a very large pot. The pot was about average, but our projects are also, everybody's projects are getting more expensive. So it's not a terrible thing. Out of the projects we got, the 4 projects, 3 of them are more maintenance type specific. I will go ahead and share my screen and show you some general locations. Not really worth your time to delve into them on like a street view basis. So can everybody see Google Earth?
Yes.
Okay. So 3 of the 4 are mid to South County. And as I mentioned, they are more maintenance type projects. They do include ADA ramps at intersections, and they do include any signal upgrades needed to upgrade for ADA, the pedestrian signal equipment. In far South County, we did receive funding for Baptist Church Road, and that is the main goal. There is pavement. The pavement has been in poor condition for several years. We've been trying to figure out how to fund it, and have finally been successful. And another kind of southwest is Barrett Station Road. It's Big Bend on the south, up to Doherty Ferry at the north end. This one does include frontage on the Transportation Museum, if anybody's familiar with that. It's been around a long time. It's a very good amenity for the St. Louis area. We are including aspects in this project to connect the museum more safely to some parking they use on the opposite side of the road. Other than that, again, pavement maintenance is a big aspect of that project. And then as we move further north, we did receive funding for a project on West Florissant. For anybody who has been following the project, we've been trying to get across the finish line for going on a decade now. The West Florissant Great Streets is to the north of the one we just received. People may think that this project would be a logical continuation of that Great Streets effort. However, it is logical, but the Great Streets took so long to get in place and get funded, and it is so expensive. The pavement needs in this area kind of forced us to look at it a little bit different and try and do kind of more of an interim type thing and get the pavement addressed, get the ADA addressed, kind of leaving most everything else in place until the planning efforts for a more transformational project can take place. The pavement does not have 10 years to wait, or people will be driving on gravel and buses will be traveling on gravel. That's important, is that the pavement issues are just can't go on. The good thing is that planning effort, we have several ideas of how to take that forward. And when that time comes, if there are major changes that come out of that planning effort, the pavement itself will be in an area to do kind of an intermittent treatment. So what we have scheduled right now, we're doing full depth repairs where needed, and the mill and overlay. Those usually last 15 years or more. About halfway through that life, if we go in there and just seal everything back up with a less intensive overlay, it's called a seal coat or something similar, that gives us the opportunity to restripe if that planning effort shows that restriping is needed. So it's not wasted money. I do wish we could afford to do great streets everywhere. It's just right now, budget will not allow. And then the one project we did receive that has significant great streets components to it, it's on Old Halls Ferry Road, far North County. Old Halls Ferry Road, this is from roundabout at Old Halls Ferry and Vale. If anybody's familiar with that, it's been in place almost a decade now. It used to be a four-way stop, converted to a roundabout. As far as we know, it's been doing okay. Haven't heard any complaints. And then to the north of there, probably 3 decades old worth of a lot of residential development. Very built out area. Our predecessors at the time of all that development had the developer build Old Halls Ferry as a 4-lane median divided boulevard type roadway. You can see the pavement needs in this street view, and that was just random. I didn't pick this particular location. So what we have found is that they overestimated the amount of traffic all these homes would generate. The daily traffic is less than half of what would be needed for 2 through lanes in each direction. So what we have programmed is to reallocate the curb space for bikes. We're going to stripe it for 1 through car lane in each direction. It already has median brakes and left turn lanes at the side street intersections. So that's not an issue. And we fully expect it to run very well, traffic level of service wise, and should be a lot safer and slower. That road that I pointed to the south end at the roundabout will go all the way up close to New Halls Ferry Road. We do have to open back up somewhat before that intersection because basically because large changes like this have to end somewhere, and that intersection is set up with a lot of extra space as well. We don't have good plans for how to continue the bikes from there. New Halls Ferry Road already has bike lanes, so that's not too much of an issue. Traffic wise, Shackelford and New Halls Ferry Road may have a little extra capacity where we might consider doing something similar in the future. However, if you look here, these white lines depict a new road of one of the final large tracts to be developed. That really doesn't show up in the current views on Google Earth, but if you turn on historical imagery, that brings up the latest image, and you can see where the subdivision is starting to take shape. And then north of that subdivision is a Boeing retreat, if anybody's familiar with that. It's gone unutilized for a long time. That has recently been sold to a Catholic university. Traffic patterns and volumes may change somewhat in the future in this area. I don't see a whole lot of these new developments using Old Halls Ferry, so I'm still very confident it will be fine with 1 through lane in each direction. But Shackelford and New Halls Ferry, their traffic patterns may change, so we'll have to keep an eye on that. This usually takes a little longer. We usually have more than 4 projects to talk about. So I will open that up for any questions on those 4. And Misty, you may have to keep an eye out. I don't know. I don't remember if people are automatically muted.
Correct. If you have any questions, you can put them in the chat and we'll be happy to answer them for you, or any feedback for that matter.
All right. So one thing that we had planned to fund all 9 of those projects. We had it in our budget. They were picked to fit within our budget. Since we only got 4 of them, that does open up some of our budget, which is good news for the next part of this presentation, as we will definitely be trying to make some use of upcoming funding for what's called Safe Streets and Roads for All, acronym SS4A, and we have a guest speaker from East West Gateway to present. So, Anna Musial, I will turn it over to you.
Thank you, Glenn. I am going to share a PowerPoint real quick, hopefully. Okay. Here. Okay, I'm hoping you guys can see that.
I can see it. Thank you, Anna.
Okay, perfect. Okay, so my name is Anna Musial. I am the Transportation and Planning Coordinator at East West Gateway. And like Glenn mentioned, we have created a Gateway to Safer Roadways St. Louis Regional Safety Action Plan. So this is an East West Gateway product that was developed with the help of consultants CBB, CDI, Equitable Cities, and Excel Business Concepts. Oh geez, how am I gonna, okay. So East West Gateway received funding for this plan through the Safe Streets and Roads for All grant, which is a US DOT program that was established by the Bipartisan Infrastructure Law in 2021. So in round 1 of SS4A, applicants could apply for funding to develop comprehensive safety action plans or implementation projects. One caveat to that was that you could not apply or receive funding for implementation projects unless you had an action plan that met the US DOT's requirements. So at the time of applying, only St. Charles County and the city of Kirkwood had qualifying action plans. So East West Gateway applied for and was granted these SS4A funds to develop a regional safety action plan. This plan will allow all eligible entities within our region to apply for those implementation fundings in the future rounds. So to focus on why we applied for SS4A fundings and why this plan is so important to our region. Roadway crashes are the leading cause of death for our youth and young adults, and the second leading cause of deaths for unintentional injuries in the United States. So when we compare the St. Louis region to our peer regions in fatal crashes per 100 motor vehicle miles, St. Louis is above that peer average. From 2018 to 2022, our region had 9,576 fatal and serious injury crashes. And during that same time, St. Louis County had 2,921 fatal and serious injury crashes. So although those numbers are pretty alarming and high, it's really important to remember that we can still make an impact on reducing those fatal and serious injury crashes. Getting to 0 deaths can sound daunting and maybe unrealistic to some, but when we look at the fatality rate, we can already see that we've had a decline in lives lost. So we have the chance now to reevaluate our systems and see what changes we can make to continue to move that needle towards zero. So for our action plan, we reviewed best practices across the nation. We engaged with our local stakeholders through multiple groups and task force. And then we did a safety analysis on crash data for our whole region. So all of this together makes up a pretty well-rounded safety action plan. And we also had Equitable Cities on our team, and they helped us make sure that equity was woven throughout the whole process. We also used FHWA's safe system approach as the base of our whole plan. This approach is looking at safer people, safer vehicles, speeds, roads, and post-crash care. We wanted to create layers of redundancy so that we have these multiple layers of safety. The Swiss cheese model that's down on the bottom right, that shows that like if a couple of the layers of safety fail, the remaining layers can step up and help protect the people that are involved in those crashes. So for example, say a driver is speeding and falls asleep while driving, but the road happens to have rumble strips, that wake him up and help him veer back onto the road. In this situation, 2 layers of the safe system have failed. He's not driving at a safe speed and the driver fell asleep. But that 3rd layer, the rumble strips, helped protect and help avoid a crash. So the safe system approach is really showing that the reduction of fatal and serious injuries cannot just be solely dependent on one person or one entity. It's truly an all hands on deck approach. So as mentioned on the last slide, there are 3 main components of our action plan: engagement, safety analysis, and policy review. And I'm going to start by talking about the engagement part first. So we created 5 stakeholder groups that were made up of local stakeholders throughout each county, and then we created a regional task force. We met with all of these groups 3 times each to educate them on our process and best practices throughout our nation. And then we met a second time to present our draft high injury networks to them and to start brainstorming recommendations for our plan. And then finally, we just met at the end of April, early May, to talk about the draft recommendations of the action plan. Next up is the safety analysis. So one of the main components of our plan is the creation of high injury networks, or HINs. The HINs are a series of maps that will show us where the fatal and serious injury crashes are occurring. So we have 5 regional high injury networks that include all modes. That includes all of our roads in our regions except for the interstates. We have the vulnerable road users, or VRUs, which focuses on bicyclists and pedestrians. Then we have underserved communities, our top contributing factors of crashes, and then one for interstate hotspots. So on top of our regional high injury networks, we also created high injury networks for each of our counties so that they can look specifically at their county to see what can be done on their own networks. So this is just a sample of an early screenshot of our high injury networks. I didn't have time to get one of the most updated one, but the high injury, the red on this map is showing where the top 10% of our fatal and serious injury crashes are happening in this region. The orange is the top 25%, and the yellow is the top 50%. In our current map, we took the blue lines off just because we didn't, they showed the bottom 50%. So some of the data behind it, we just didn't really like how it was working. So we took the blue lines off of our regional maps, but we left them in our county maps. So when our plan is final, we'll be putting this regional high injury network on our website so that the public can access it and use it. We dove a little bit deeper into the crash data and looked at systemic treatments that our locals could deploy on their systems to help reduce the fatal and serious injury crashes. We identified high-risk roadway characteristics and what countermeasures could lower those risks. We also focused a lot on intersections, roadway departures, VRUs, and speed management. And a lot of these countermeasures that we suggest are a part of FHWA's proven safety countermeasure list. And then the last component of our plan was the policy review. So we identified 9 policy programs that are needed, programming needs and opportunities for our region. So these are listed in no particular order: speeding, seatbelt use, helmet use, distracted driving, impairment, red light running, bike ped safety, unlicensed drivers, and roadway departures. So to help address those 9 opportunities, needs and opportunities, we came up with 16 policies, program recommendations, and we divided those into 4 categories: the safe road users, safe roads, safe vehicles, and enforcement. I'm not going to go through each of those just for the sake of time, but we then took all 16 of those recommendations and we mapped them out with our 9 areas of needs and opportunities, just to show that just one of these recommendations could possibly hit all 9 of our needs and opportunities. So we can really take care of a lot of our issues within just doing one or 2 of these programs or policies. We also wanted to make sure that we addressed the great work that's already being done in our region and try to build on them. Just for example, in St. Louis County, we wanted to always point out that the city of Kirkwood had already had an action plan completed and that they're already doing supplemental work for their action plan. And then also Webster Groves is going to be developing an action plan as well. They received SS4A funding last round. So through all of this work, we proposed the goal of reducing our roadway crash fatalities and serious injuries by 50% by 2050, with the commitment to ultimately ending roadway deaths. And we decided to set an aggressive and achievable goal. So we have planned a way to reach this reduction through the main components that I had just spoken about: the high injury networks, the systemic treatments, and the policy and programming. To come up with that 50 by 50 goal, we wanted to make sure there was real math behind it, and it would be truly achievable. So if you look at this chart, you'll see those 3 main components of our plan broken out, and we're showing that the region can address 95% of the top 10 and 25% of the region's HINs. It can reduce 30% total of the fatal and serious injury crashes in the region. If we implement those systemic treatments, we'll reduce another 10%. And finally, if we implement policies and programs, we'll drop another 10%. So all those together would give us 50%. So this slide just shows how we'll achieve those goals. So by 2030, we want to have 5% of our regional high injury network addressed. And that might sound like it's really coming up quick, which it is, but after reviewing those top 5, a lot of those roadways are already either under design or under construction. So a lot of our local communities and counties have already recognized that those roads had safety issues and they're already addressing them. By 2030, we also want to pilot 2 to 4 new systemic treatments countywide, and then kickstart 2 to 4 priority policy recommendations. And then by 2035, we're addressing the top 10%. And again, a lot of these are being addressed already. Systemic, we're looking to implement now 4 to 6 systemic treatments countywide. And then our policy and programs, we want to implement 4 to 6 policies and recommendations. And then finally, by 2050, we will want to have addressed the top 25% of our high injury network, implement all of the systemic treatments countywide, and then implement all of the policy recommendations. So just to show kind of where we are today and where we've been, this has been a very accelerated process. I think usually Federal Highway says this could take 2 years, and we've done it in 6 months. We wanted to try to create this action plan for all of our locals so that they could have that ability to apply for SS4A funding in the future rounds. So we started the week of Thanksgiving, and we're taking the draft plan to our board of directors this May, like next week. And then we'll be taking it back to them in June to hopefully finalize and adopt the safety action plan. And so with that, I was just going to leave my name and contact info, and then also our Sean Light and Joanne Stackpole were instrumental in this plan, and their contact info is there as well from CBB. But if anybody has any questions, I'd be more than happy to try and answer them.
Anna, there's a couple of 3 comments, questions in the chat box from Sarah. First is, why is frequency of serious crashes so high in St. Louis County? Do you know why? I don't know if we have that answer yet or not.
Off the top of my head, I can't tell you the exact reason. I believe that St. Louis County, sorry, I have all of the county data in my head right now, but I know we talked about this in the stakeholder meeting, but I think that St. Louis County's was higher, but you also have the more vehicle miles traveled in the county. Glenn, I know that you were there. I don't know if you remember the exact reason. Sorry, I don't mean to put you on the spot. But I can also look that up and give that to you. The next one for collecting data.
Can I just ask a question? Because I thought that graph showed the data with like taking into consideration vehicle miles. So
sorry.
I don't recall exactly which map we share or what the graph was prepared from, but they sliced and diced the data in many ways. A lot of it is just pure crash numbers.
okay.
To really focus in on where the fatalities and serious injuries are happening. It is definitely harder to make a dent in the busier roads. With the less busy roads, sometimes it's really easy to figure out just what's going on. There's just less conflict. But I think Anna really hit the nail on the head when it's just the busier roads are mostly in the county right now. That the city has been losing some population. They might have a little bit less of a rate, but or less of actual crashes. But we are definitely going to take this seriously, and like I said, we are going to have a little bit of funding to hopefully address our more major roads that come out of this study.
So for all of our crash data that we used all crash report information. So any data that we got was collected from crash reports, and that includes the vulnerable road user data.
So I just wonder if you're capturing the cyclist and pedestrian crashes. Like, are they reported?
The only way we can analyze it is if it's reported. I mean, unfortunately, I know a lot of them are not being reported, but there was really no way for us to, we had to have a common way of looking at all crash data throughout our whole region. And that's by state, by county, but the by state is the hardest part, but we had to have something that we could relate back to, and that was that crash data.
So who reports crash data?
The police reports.
So if police don't show up to a scene, then it doesn't get reported.
Yeah, I mean, yeah.
Okay. And my experience with the police as a cyclist is that I don't know anyone who's ever been in a crash where a car has been ticketed. So it strikes me that their attitude is it's a no-fault collision.
I can't speak for the police. Like I said, all I know is what the data that we received. So
yeah, the police crash reports do not assign fault. So even if they feel like one party was at fault versus another, the report would still be written.
I would add too that I've been in this business for almost 30 years now, and police reporting has gotten substantially better over those 30 years. And being able to mine their reports for data has gotten much easier. Given that this is focused on serious injuries and fatalities, I would really hope that they write a report on those at a minimum. I do feel for you as a cyclist that you might feel a little underwhelmed at what they assign as a level of importance to, what you experienced. But if there's a serious injury, it's hard to imagine they're not writing it up.
As long as they're notified, it would be written. Just for everybody's knowledge, years ago, there used to be a dollar value assigned to a property damage only crash report, but it hasn't been like that for years. There is no dollar value to trigger a report or not.
Well, as a cyclist, usually the dollar value is quite high in terms of medical bills. Inevitably.
Yeah, no doubt about that. But I just mentioned it because if it was a property damage only and a $500 bike got damaged, the report would still be made. But back in the day, that might not have been enough to trigger a report. But there is no dollar value that triggers a report for quite some time now.
Can I ask my third question? So you talked about fatality rates are actually decreasing. Is that true for vulnerable road users? Because I imagine that's actually the opposite.
I can't tell you that off the top of my head. I can't tell you that off the top of my head right now. Sorry, we're literally we just processed ended our final draft last Tuesday. So we're reading through everything right now, trying to get it approved for tomorrow. So I haven't decompressed a lot of this data, but I can get back to you on that as well.
Because I think vehicles are safer for the occupants, but the way they're built is more dangerous for vulnerable road users, like high off the ground SUVs.
And our plan does go into a lot more detail. I had 10 minutes, so I just wanted to try and hit the main components of our plan, but we have charts and graphs that dissect a lot of this data, including all the VRU data as well. So when that plan is ready to go, I'll share the links with you guys and you can dive into that deeper as well.
Thank you.
Anna, I don't mean to put you on the spot, but I was just curious since our last meeting. Have you guys had any more discussions regarding how you're going to keep this plan updated?
Not exactly. We're still trying to get the first one done.
Okay,
but
totally understand. I just know this is about the time of the year that the 2023 crashes might get certified. So just kind of wondering if it's going to be annually or 2 years, 5 years, that kind of thing.
The plan itself will likely not be updated. It will probably be updated every 5 years when we get a whole new fresh 5 years of data. But the data, like our maps and things like that show our high injury network, we are going to be working with CDI, who's the one who did all of our GIS work. They're going to be teaching our East-West Gateway GIS staff how they cleaned up and put together all of the data. As you can imagine, again, we're looking at 2 different states with all different wording and file data and stuff. So we're trying to figure out how easy that will be for our staff of 2 to update. So depending on how that is, it could be every year, it could be every 2 years, but it'll definitely be updated.
Great.
Anna, there's another question in the chat. When you say you got input from the community, what disability organizations did you speak with?
So because of our extreme deadline that we had, our fast-paced track, our public engagement, we really focused on our stakeholders because they would be implementing the plans. As far as a disability organization, we had the Office of Disability from St. Louis City that was a part of our stakeholder group, and they were our disability representation for this part of our plan. I do want to say that the engagement for this has been a little bit different than a normal type engagement. We're trying to get the plan done. So like I said, our main focus was with the stakeholders for this part. Now that the plan's developed, I think is when we really need to start our engagement with the public. So we're going to be doing like a social media campaign, and we'll be reaching out to people with this data and asking for feedback after. So like I said, this part is really just the meat and the potatoes of the data. And now that it's done, we can look into what else we need to dive deeper into, maybe do supplemental action plans and those kinds of things.
One last question or two. Do the crashes include highways? And how would the numbers change if they were not included? And I'm presuming that means like interstate highways, which were not included, but you can comment on that.
Yeah, so whenever we were looking at the full crash data, like county numbers or regional numbers, all roads were included, including interstates. The only time we took interstates out of our analysis was when we did our all modes, all of our high injury networks. We just didn't want the interstates to skew our crash data. Like we wanted to have things that our locals could work on. Otherwise, it would all be MoDOT and IDOT routes. So we took them out of our first 4 high injury networks, and then we have a separate high injury network for just interstates and ramps, so that we can still identify where those crashes are happening along our interstates, but they're just not skewing our county regional data.
Thank you. Well, if there's no other questions for Anna at this time on the SS4A, I'm going to speak with you for a few minutes quickly about one of our design projects, the Yeager-Milburn roundabout. And I'm going to share my screen here. And let me adjust this a bit. Is that better? The Yeager-Milburn intersection is in South County. You can kind of see highways to the north that's 270. On the west side is I-55. You got the Mississippi River to the far east, and the Merrimack. You can sort of see the Merrimack River down in the corner. Anyway, Yeager-Milburn down in southeastern part of St. Louis County. It is near the Oakville High School, just north of the high school. And in fact, there is another elementary school right on the corner. So over the last few months, since our last meeting here in November of 23, we've had quite a number of design projects with public involvement, public engagement meetings. On Yeager-Milburn in particular, we've had at least 3 meetings with the public, some with the school, the property owners, and with the general community since last November. And then just last Monday, we had another public meeting and presented this project to them yet again. There were at this intersection, and this is just a generalized roundabout photo I'm showing right here. May be familiar with them, but I don't think the concept is very familiar to the folks down in South County. They're not quite accustomed to these things, and that was a big reason why we've had a couple public meetings with them to help explain. This intersection, there were 48 crashes with 10 injuries in the time period of 2017 to 2020. And the county got some funding, federal funding through East West Gateway. It's congestion mitigation and air quality, CMAQ funding, to help improve the operation of traffic at this intersection, at this location. So, like I said, we had the meeting last Monday night. There were around 120, 140 folks at the meeting. We talked about this intersection. We showed them a lot of graphics on it. We gathered comments from everyone that attended. There was about 61 that were against the idea of a roundabout. There was 25 in favor, and there was 4 that were somewhat indifferent to it. But our councilman Tracus down in South County has asked that they provide feedback, noting that it is totally up to them if they want to proceed with this project or not. So here's kind of a simple layout of what we were sharing with them, how we could implement this roundabout at the intersection. You can see there's the roundabout idea includes medians on each of the 4 legs with a pedestrian crosswalk set back away from the roundabout. And there's a little bit of extra green space in 3 of the corners to kind of separate the pedestrian traffic from the intersection itself. So, you know, it's a proven concept. It improves safety quite a bit. It reduces the number of conflict points between vehicles and as well as pedestrians, and improves safety quite a bit over what we have now, which is a 4-way stop controlled intersection.
Four-way stop controlled intersection that is routinely disobeyed.
Yes. Yeah. And therein is the problem. And some folks I remember from the past meetings had requested simply more police enforcement at this location, but you really can't. It's unrealistic to have police on the site 24/7. So trying to come up with a better way to improve this area. But it is, as the councilman recognized, up to the people if they want to see us proceed with this or not. So any questions on that?
There were a couple questions in the chat, John. You could address those, please.
Trying to get back to my screen. Sorry.
No, you're fine. And if, for that matter, I can just read them to you if you'd like. The question
Sure.
comes from Jason Hartsfield. Are you going to use any kind of barrier to keep pedestrians from just walking through the roundabout? Because they will absolutely do that.
Hey, John, I'd like to suggest Joe chime in. I think he's a little more familiar with the latest design.
Sure.
Thanks, Glenn. So in this particular roundabout, there won't be a barrier that keeps pedestrians from walking in locations other than the crosswalk. But realistically, that is going to be the case with any roundabout. However, we are introducing raised crosswalks with this design to slow vehicles as they approach and this is actually a mini roundabout design. So the center island is designed such that the school buses can get around it without driving over the island. But if we had a large delivery truck, tractor trailer, they can still navigate the intersection as they do today, but they will have to drive over the raised center island that's in the roundabout. So that's an answer to both of the questions that were just posed. Todd Antone, what happens next if the public vote is against the roundabout? The project will be canceled, unfortunately. We will look at some of the considerations that have been brought to us by the public and make a determination as to what we do next. I don't have a definitive answer to that yet. What I do know is that the federal money will no longer be available. And this intersection, as we move forward for safety funding, while it does have a high crash rate, it does not rank on the new East-West Gateway Vision Zero model as a high injury network location. So it most likely will not be pursued with the same size of program if we go to look at something else. From Sarah Hartley, can't you put in temporary treatment to get buy-in from the community? Not a roundabout. There's not enough pavement there to do something temporary in that respect. But yes, we will be looking at other options that are of smaller scale. What is deadline for the funds to be spent? Essentially, we either move the project forward. We have to enter right-of-way acquisition very soon to bring this project to completion. At this point, where our consultant is pulling together a summary of all the public comments that we received, we will then talk to the councilman and determine whether or not the project is moving forward. Either we're going to move forward relatively quickly or the project will be canceled. See, do I know why the public is not in favor of the project? Generally speaking, the public is not in favor of roundabouts as a concept, is largely what we heard. There's a lot of distrust over the safety aspects that we have put forward. We did bring John Miller from FHWA. He's our state of Missouri safety lead to help us to explain the benefits, but we did get some traction. There are definitely a number of residents who are interested in the project, and more so than the first time we went and talked to the public, but it may not be enough critical mass to deliver it. Yeah, level of service on the intersections from Sarah Hanley. Did you provide level of service data to the public who are opposed? Absolutely. The roundabout we were showing functionally was better, although it's not the reason we programmed anything here. We weren't looking to improve capacity. The project was scheduled as a roundabout because we had CMAC project that we thought we could deliver that would give us the safety improvement that would be good at the location. So level of service absolutely improved. It went from a D and E, I forget which legs are which, to A all the way around. We showed Q links, we showed the level of service difference. It did not resonate with as many residents as we would have liked to see. From Sarah, too bad. We wholeheartedly agree. There's still hope. I mean, it's if the councilman wants to move it forward, we will move this project forward. We believe in it. We believe it's a good project for the location. Any other questions? All right, fantastic.
All right, thank you very much, Joe.
So with that, I am up again to talk about the.
Joe?
Oh, excuse me. We
Oh.
have at least one prior.
Did I miss one?
No,
We have,
Joe, we have a substitute for the arterial study.
Oh, okay,
Okay.
no problem.
Yes.
Sean Tooley is going to present
Sean,
for that.
yes.
Oh,
Sorry. Go.
Fantastic. I am
There you
happy
go.
to cede the floor. Welcome, Sean.
Hello all. Let's see, am I visible? Okay, can I share my screen? All right, can you hear me okay?
So we can also see your screen. Thank you, Sean.
Perfect. Hello, Sean Tooley, Missouri Department of Transportation. We at MoDOT have been working with East-West Gateway on this new resource for the region. Several folks who are on the call, like John Shrewsbury, Joe Calusa, Glenn Henninger, have been involved, also Ray Golick. And so this new resource will be done in the next month. It's effectively a design guide, but it's actually more than that. But we can't call it a design guide because we're not replacing the engineering policy guide. We're supplementing it. It's a resource to help governments like St. Louis County, like MoDOT, like St. Louis City, et cetera, the actually the 5 counties in the region who own and operate arterial roadways like Big Bend, like Brentwood, like Manchester, like Olive, to walk through a more detailed process during the conceptual phase. Probably get into what that is. So first I'll begin with vision and goals. You'll notice on the left, safety of the most vulnerable road users. You saw that in East West Gateway Safe Streets and Roads for All. Fascinating. We actually started this before that grant was ever awarded. We came up with this vision, and then later on, East West Gateway's other study, Federal Highways, other guidance like the manual uniform traffic control devices would later emphasize vulnerable road user safety. You see the words wide range of community context. As planners, we call that typology. You're urban, suburban, rural, but then go deeper into now how does that mix with place type? Main streets, mixed use streets, town centers, but also your urban, your commercial corridors. And you also see provide for users of all modes. So that's in our vision, and then our goals you see on the right. You have 4 goals. For some people, it might be confusing: flexible and consistent, flexible in design, consistent in process. We use a conceptual engineering process today when we should be adding in planning, public involvement elements during the conceptual process. For example, we just heard about Yeager Road. You had your, if I heard correctly, your public meeting after you develop your preliminary plans. That's the way MoDOT mostly does our projects, actually, and that has worked in many cases, but also a number of projects have been torpedoed because of that late engagement. And so in here, you'll see we actually recommend, depending on your project type, you either have 1 touch point with the public, 2 or 3 to build that support while you're doing your design, or actually before you do your design, before you do your preliminary plans, so as to actually have a project that doesn't get torpedoed as easily. And you pull in that engagement, that inclusive, collaborative, you pull in that stakeholders. I see Metro's on the call, I see GRG's on the call. You know, we're your peer agency, but also not just that stakeholder engagement, but also that public engagement from the beginning for your corridor project. So inclusive, flexible, consistent, multimodal, again, variety of users. For all 5 counties, we actually do have a variety of users. Even in rural areas, we still have people out cycling along shoulders, surprisingly. So can we be inclusive, multimodal, and place-based I'll get to later. And then safety, that what design options you use change for your user. So let's on briefly. This engagement, the creation of this resource has actually been through 5 workshops. 4 are listed here. We actually incorporated, again, all 5 counties, St. Louis City County, Franklin, Jefferson, and St. Charles, and also Metro / bi-state. We include GRG, we included TrailNet during at least the first 3 out of the 5. But we've definitely wanted to make a resource that was usable by all 5 counties and by our peer transportation regional agencies to create this resource. You kind of see those workshops here. The one missing is the training one, where we gathered like your last input on the actual document itself. We did not reinvent MoDOT's policy on an engineering policy guide on how you develop a project. So we actually decided to live within this wheel of activities on the left, even though it's imperfect, we lived within it. And we have more detailed in the document, how do you use this document to fill each EPG step. We give more detail. Now, it's not a requirement. It's an optional supplemental. Use it, you build out your project as you see fit. But we put something really up front that can help roll away some of those issues with public involvement by saying, hey, it's not just step 1, the project team, all engineers, creates a project and goes straight to budgeting estimation to make a request onto the, for MoDOT, the STIP, or for East West Gateway, the TIP. And then we actually have, you see step 2, that project team should work with, say, planners like myself, who have a background in planning, that you work with traffic and safety professionals too, because we discovered at MoDOT that those people actually are generally not involved in that type of scoping of a project. And so signals get added, and then when you get budget cuts, then you cut out the signals or what have you. So we want folks to engage with traffic safety and planning to help develop the project at the scoping stage as well. And then from there, come to project initiation step 3. You see local agencies, or in the case of you all, St. Louis County, that you maybe work within your own agency, or work in, if it's an incorporated area, that county, say Brentwood Boulevard goes through Clayton, that you actually visit Clayton and say, here's our project that we're thinking about working, applying for East West Gateway funds or other funding source. And here's what study type or thing it's going to be. And here's some general scope. This is your opportunity to give us input as we're developing that scope before we pursue funding. So if City of Clayton, for example, says that they're willing to help fund, something extra than you were planning on, say a shared use path or something, then you'd be able to add that to your scope before you go after, before you actually advance to funding. So it's helpful to create your partnership. And then Glenn, you had asked about step 4. So here we say, get your estimate for the budget, and then you put that in line for prioritization and programming. I'll move on. We actually break everything out into 3 categories of project types. You have your projects that are just routine. You're not going to need to get public involvement on, say, we're inspecting a bridge or we're repainting a bridge. Do we really need public involvement on that? That we just need to inform them. But for your minor capital project, your major capital project, yeah, you do need to get input to help you shape the project. Is this pedestrian crossing really go here or here? Should we consider this type of striped bike lane or this type? Should we consider a roundabout or a J-turn or signal? And if you'll notice, as minor to moderate on the middle and then moderate to major on the bottom, we're not being so prescriptive. We're leaving agencies the ability to have discretion at saying which one applies of these 3 within reason, and then build out the project. So we give them kind of this new checklist, really simple checklist for following MoDOT's EPG process, step 1, 2, 3, 4, 5. His design begins at 6, and kind of give you the here are the activities that many agencies like yours are already doing in conceptual and preliminary engineering. Just pull some of those activities forward and get public input on those activities earlier in the process, so that the public isn't, coming with pitchforks to kill your project afterwards. That did happen to us on one, and we had to radically change. So yeah, checklist with a bit more steps. And then we also kind of give, for those different touch points with the public, 1, 2, and 3, what is some framework for that? Should you, like, what input are you going to gather? What should go in your memo to document that you did it? What kind of engagement type should you consider? It's more advisory, and it's to help folks who are not accustomed to doing engagement, which even includes a lot of our folks, to gain some framework, gain some structure as to how to go about it. And we've discovered in the same part of the county that by doing this process, we've been able to keep a road diet and add bike lanes and add a pedestrian crossing in a part of the community that had formerly killed those things on a county roadway. So that's not that's the benefit of doing public engagement before you ever develop your preliminary plans, doing the conceptual level. And yeah, same thing with the highway. And we're just doing that in the last 2 years. So although we did it in a few cases, it's still kind of a lessons learned We're still going through the learning lessons for how to do this. So how do you go about making your decision as to what design solutions to use? Because we said EPG, we said checklists for your like existing conditions and stuff. But there's also, how do you decide what solutions go into your project? And so we have this decision-making process where you first say with your planners, or what kind of area are we? You know, Chesterfield has industrial valley, it has shopping valley, but also has very dense residential being added. Like you have a variety of context, in that case suburban. And then we say, what are your existing plans? Some plans, let's say Woodson Terrace, Woodson Road wants a road diet on Woodson Road, MoDOT roadway. And they developed their own conceptual plan for that. Well, how do we need to pull some of that and evaluate it for our agency's study of that roadway in the future. Who's our user? Those plans, your bike ped plans, your comprehensive plan, they often tell us who your users are because you have that analysis in those. And we need to then say, based on who's our user, what is the existing information that already exists, what is the context, okay, what typology, what kind of place type with mobility fits in this space. Oh, by the way, we also give some helpful questions to work through as you go about making a decision. I know this is tiny, it's hard to see, but we try to give questions for folks to consider as they go through that step 2 and step 3. And so here's what your typologies look like. And I'm not going to show too much because I know we're have a little time. So you have on the right which design tools go with each of the typologies, and they're like a traffic light because that's who we are. We have green, yellow, and red. You know, recommended, caution, and not recommended to go with the different typologies. Because like here for mixed use, you see red, queue jump, transit signal priority. Your mixed use, you may only have 40 feet. And you have to decide who gets priority. Mixed use, your highest priority is bike and ped because you need that foot traffic to generate business. And you have a lot of foot traffic, and so you also might need that parking instead of your, say, bus lane, for example. So we try to give a, advisory level there, as well as who your modal priority is. And so some wonder, what does that look like on a roadway? And so you'll see here 3 examples where and it's hard to see, where we said, here's what typology looks like on a state DOT road. And so your decisions for design options will vary based on your typology as a result. And we did that on 231, Lemay, Telegraph, Kingston, Union. It's all the same road to us because it's 231, even though it has like 3 or 4 names. And then we come South Broadway. And we actually broke out it into 4 segments. And we said, all right, here we can get a bike lane, here we can't because of these reasons. Here we can get parking on the road, here we can't for these reasons. And that helped guide that, breaking out that segmentation by typology, helped us with making design decisions. And lo and behold, the public helped us through those design decisions as we were presenting the information to them. And then kind of the great reveal is which typology goes with which county. And so on the top, you have your AASHTO context categories of rural, urban, suburban. On the left, you have your typologies. And then in the cells, you have the code that goes with them, as well as which county goes with them to the best of our ability. We actually ask you all, project teams, individual jurisdictions, to work with us and with yourself, your own folks, to kind of say, is this correct? But because we have to get this done quickly, we're not able to dissect every stretch of roadway in every county to be perfect on that. So we say, project teams, as you're going through the decision-making process, you go deeper into this and have the debates of which typology you are, which solution is a better fit for that typology. And so then we say, what solutions are we considering? There's a bunch in this chart, and we're not going to have all of them in our design guide. So we had to pick and choose which ones are aspirational. Because I think many of us know how to put in a center median. We know how to put in rumble strips, we know how to put in, say, a shared bike lane. But we might struggle with putting in a roundabout, which we do. We might struggle with putting in vertical separation for a bike lane or a pedestrian refuge island, but there's not as much experience doing those. We've done very few of them, if any. And so we had extra pages in the document where we put that in there so you can then cut that sheet out, put it on a foam core, take it to public meeting, because you're not going to print out the NACTO version. You're not going to print out the AASHTO guide version that's like 10 pages long. You need like 1 to 2 pages to show them. And so we created that 1 to 2 pages for the aspirational ones. So I'm kind of skipping through a few. Yeah. Use my time wisely. No more than 10 minutes. I want to emphasize that we're all in this together. I know the roundabout in South County was just kind of a poking fun because we're all going through that right now. We've only done a few projects in this new way of doing things. And it's very much a learn as you go. And we've definitely had to change practices in order to see projects be retained in the last few years. And we recognize that we have to, we don't know how we're going to roll this out yet for the coming years and projects. But we now have a resource to help us make for better projects and hopefully make for safer projects too. I think I saw some questions, so I need to like stop sharing.
There is one there, Sean, that maybe you can respond to that. So it's a strategy for developing a more universally designed roadway. That's the question.
Universally. I don't know if I can comment on universally. I think we're trying to emphasize that your design is based on context and you design for your user, and you design for your place type. So there's not a one size fits all. It's more of a kit of parts to help guide you through a decision-making process so you get an outcome that is more supported by your community, but also that you can keep that project. I see something about Kings Highway. That's the city. Oh, Charles, you're making a point here that they should have done community engagement first. Yeah, they're struggling too right now. Saw that in the news. Other questions? I know we have other departments on. Thank you for Parks and Rec for being here. Imagine the health department's on. Okay.
Well, any other questions from anyone? Put them in the chat, or we can, we may have to move along here. Next up in our agenda is a presentation by our Department of Planning, St. Louis County Planning. Paul Weatherford's going to speak about St. Louis County's 2050 plan. Paul?
Thanks, John. I'll keep it brief here. Just wanted to pulling up our plan website real quick. Possibly, maybe not. Let me just not do that. Yeah, so St. Louis County 2050 is the county's new comprehensive plan. We St. Louis County haven't done one of these in a really long time. The last comp plan the county did was 1980. The zoning ordinance was even older than that, 1965. So if you look around you at the built environment that you see every day, a large part of that is that we sort of the regulatory framework that we have doesn't fit with the types of communities that we want to see. So you know, in county planning, but also county government, view this as an opportunity to sort of take a minute and kind of really establish where's the county at right now. How did we get to this position? And if we want to see something different moving forward on to 2050, we're going to have to we're going to have to change some of the ways that we do things. So the comp plan is not just a project of the Department of Planning. It's really a platform for all of county government to utilize as they make decisions, as they prioritize, as they create their budgets, as they consider new policies and programs. So we do have a website, stlouiscounty2050.com, that it was not really letting me share. I think I might have too many tabs open or something currently. But you can visit our website and get involved in the project that way. You can sign up for updates, send us a message. If we haven't spoken to you or your organization already in this planning process, please reach out. We want to. There's a brief survey you can take on our website. There's a mapping activity we have where you can drop a pin on the map and just leave a comment about this part of the county works well for me and this is why, or sort of the opposite. This part of the county induces a headache every time I'm there and this is why. We want to know both so we can really identify what's working for folks, what's not, and start to ask questions about how can we do things different to create the communities we want to see. Also, we're about to release our existing conditions report. That will be posted on the 2050 website. Really a real in-depth analysis of current conditions in the county, housing, transportation, infrastructure, open space environment, land use, all of the things that create a community. And then we're getting ready to, in the summer, move into our kind of scenario planning process, where we will be talking with folks like you and organizations like all of you on the call about what are the potential tools that we have or we could add to our toolbox to sort of change the trajectory of our region. Some of the central themes that we've kind of uncovered or identified is it's been mentioned on this call even, is population stagnation, both in the county but also region wide. Sort of the cost burden of the infrastructure systems that we've built, and this reliance on future growth to support sort of an expanding infrastructure network. And we've really kind of hit the wall doing that, right? We've all seen in the news the county's fiscal position, and so we as we move into 2050, we really need to reconsider how we approach everything within county government, and we're really excited to be doing this. We've gotten a lot of positive feedback, a lot of good support within the county, both from the county executive's office and the county council. So we're looking forward to sort of the next steps. And again, if we haven't spoken to you yet or your organization yet, that's probably an oversight on my part. So I apologize, but reach out to me or Jacob, and we would be happy to facilitate a conversation and as we move forward. So that's all I have. If there are any questions or anything, I can take them now, or I know we're running up against the scheduled time for this meeting. You can always reach out. So.
Thank you, Paul. There was one comment by Jason Hartsfield that says it's also extremely difficult to get around if you can't drive. If you want to.
Yeah, no, you're spot on, Jason. We've and this was a decision, I'm not saying right or wrong, but it's sort of, as a government, we've decided to facilitate the really efficient movement of personal automobiles in our community. And if you can drive and you have a car, it works really well for you, right? We don't have traffic. You might get a pocket of congestion every once in a while, but we don't really have traffic issues. But that also makes it extremely difficult for somebody like Metro to efficiently provide services when we are so spread out, right? And we haven't been adding people as we've been spreading out. So yeah, those are the types of things that we're looking at and considering, and how can we create a community that works for everyone. So yeah.
Anyone else have any more questions or comments they'd like to put in the chat? All right, if not, we'll move on to Joe Kalissa. He is going to talk about the county's budget. Joe?
All right, thank you, Misty. So the county, I won't speak to the county's global budget. I'm going to speak specifically to transportation. As you've seen in the news, the general fund does have some issues, but so does our transportation budget. What you don't see is the headlines, because we don't outspend our transportation budget. We always tailor our program to the size of the budget that we're given, which means that we cannot provide the transformative improvements that we'd like to. In fact, it means that we're tens of millions short annually of providing for basic system maintenance, which is unfortunate. Now, we did have a fantastic influx of funds. $40 million was given by our county council specifically for concrete subdivision roads, which does help fill a hole. But it's a hole that is very deep, and we still need continued funding to maintain our subdivision streets, which are not eligible for federal funding of any sort, and comprise over 50% of our system. So our major roads, we are still pursuing federal grants at every opportunity. We're very excited about this round of SS4A. While we cannot pursue an implementation grant, we are going to be pursuing several grants for road safety audits, as well as a few other initiatives. We're looking to get our Smart Streets initiative demonstration corridor, which Smart Streets is our methodology for putting bus priority and preemption car-to-car communication onto a corridor. So there's a lot of enhancements that are going to come for transit as well as EMS through those initiatives, with the goal of having a system similar to Gateway Greenlight out in St. Charles County, where vehicles can go, anywhere on our system, and for bus preemption and fire EMS, they're going to be able to use our system wherever they're at. So those are exciting. Overall, like I said, our budget isn't where we want it to be, but we are excited about the arterial guide. While it was a partnership between East West Gateway and MoDOT, it's something that the county fully intends to use, and we've been along for the development process the whole way. We're going to be using it for scoping new projects, but at the end of the day, unfortunately, we'll always be limited by funding. That doesn't mean we can't do great things, but that the reality is the transformative projects like our West Florissant's Great Street project, where we're going to rebuild the corridor to really provide excellent multimodal options, it probably won't be possible everywhere. That's the downside. So without getting into the numbers and recognizing that we are running right up against time, do any questions about the financial side of the county's transportation system? All right, I'm not seeing any questions come in, so we can open it up to open discussion. Anything you'd like to talk about? All right, doesn't look like we have any open discussion items coming in. So as we close out, I'd like to remind everyone that the county's website does have an interactive GIS map with all of our projects, which are under design or under construction. And we have a significant amount of information about how we're planning for the future. Now, right now, that does not reflect MoDOT's arterial guide. That is something we'll be adding after MoDOT reaches publication on that document.
And also the Vision Zero data will be reflected there as well once it's shared. Just poking Anna again.
Right. Well, thank you for joining us today. Very much appreciated. Have a great day, everybody. Be safe.
For your participation.
Everyone.